blah, 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 blah.
Welcome to the Our Forever Smiles podcast, a podcast created to support mothers of children who were born with clefts and those who love them. I'm your host, Laura Arroyo, and I'm also a mother of a daughter who was born with a surprise cleft palate. I know the challenges you face every day, whether you have just learned the difficult news of your baby's cleft lip or palate, you're in the midst of pre-op or post-op, or you're an OG cleft mom. This podcast is for you. In a weekly conversation, we will talk about everything from feeding and speech therapy to surgery and school. We'll share tips from guest experts and advocates and even share a little joy in the process. You can listen to Our Forever Smiles wherever you listen to podcasts. Don't forget to subscribe and stay tuned. Hello, welcome back to the Our Forever Smiles Cleft Mom Diaries and Support podcast. I am Laura Arroyo. Before we jump into this episode, I would like you to join this community to hear conversations with other cleft moms and advocates that will help you feel supported along your journey. All I want you to do is click on the Facebook group page that is linked in the episode notes. You can speak directly to the guests from this podcast, ask questions, and talk to a community of cleft moms that are eager for answers, but also willing to help. Just as a note, we're not medical doctors, and we do not intend for you to use the information that we share here as medical advice. We are parents and advocates who love our children, and we're sharing our own personal experiences. This week, I've decided to focus on an episode that will help mothers who are just finding out about their baby's cleft. I found out about my daughter's cleft upon birth, but I know that many of you find out during your anatomy scan or sometime during your pregnancy. So whether you are finding out at your anatomy scan or upon birth, you're in the right place. But before I get started, I just want to say that it is okay to feel disappointed. It's okay to worry. It's okay to feel sad. It is okay to cry uncontrollably. It's okay to feel guilty. It is okay to look at pictures of other cleft babies. It is okay to stare at your ultrasound. It is okay to think about it and want to talk about it nonstop. And it's okay to worry about what they will look like. All of those feelings are valid, and all of those feelings are real. Many of us mothers who have children who are cleft affected have felt those very same feelings, and so I just want you to know and understand that you are not alone in your thinking. But I also want you to just take a deep breath, and I also want you to know that it will be okay. And literally these feelings, these moments are fleeting, and you will not feel the same way that you feel today a year from now. It's all gonna be okay. I promise. Okay. This episode is also recommended for your extended family to get a better understanding of your baby's cleft. So feel free to share the episode with your moms, other moms, your grandparents, partner, husband, aunts, cousins, uncles, and everyone that you think the episode may be helpful to explain the cleft to. So let's just get started. So in starting with the basics, a cleft lip and or palate is a split in the upper lip and roof of the mouth. The severity can vary greatly and can include the lip, nostril, gum line, and palate, the roof of the mouth. Your baby can be born with one or the other or both. There are 4 different types of cleft lips and 5 different types of cleft palates. The 4 types of cleft lips are unilateral incomplete, unilateral complete, bilateral complete, bilateral incomplete, and complete. The 5 types of cleft palates are submucosal, soft palate, incomplete soft and hard, bilateral complete, and unilateral complete. Just to provide you with some cleft statistics, about 1 in every 700 babies are born with a cleft globally. I know we have a global audience here, so if you're interested in learning more, there are lots of resources online where you can do some self-led education. The following statistics that I'm going to share are for the United States. About 1 in every 1,600 babies is born with a cleft lip and a cleft palate in the U.S. About 1 in every 2,800 babies is born with a cleft lip without a cleft palate in the U.S. About 1 in every 1,700 babies is born with a cleft palate in the U.S. So you may be asking yourself what causes a cleft. This is the part where I also add that I am not a scientist. I know our community has some strong feelings about this. I'll share what is out there, but I want you all to know that there is very little evidence that supports the cause of a cleft. There are just a lot of theories. So these theories range from taking Unison pregnant, Tylenol, the MTHFR mutation, folic acid versus folate, the baby's neck being attached to its chest during gestation, or their tongue attached to the top of their mouth, etc., etc., etc. You will see it all, and it is very easy to research yourself into whole because you want to know and understand why. That's so understandable. This is what the research does say. There are possible causes of clefts. There's genetics. Individuals who are born with a cleft have a 2 to 8% chance of having a cleft-affected child. 15% of clefting is caused by a syndrome. Environmental factors can be smoking, diabetes, some seizure medications may cause a cleft, drug use, and then prenatal nutritional deficiencies. Normally, you will find out about your baby's cleft via 2D or 3D ultrasound, or you will find out during your baby's newborn screening. Some mothers don't find out until days later as they attempt to feed. So I've spoken to some mothers who did not find out about their baby's cleft until days after they were born. In terms of specialty feeders, there are 3 commonly known specialty feeders. There is the Haberman specialty feeder. It is a valve, a disc, and a valve membrane, and you have to have a light squeeze for controlled feeding. There is the Dr. Brown's specialty system. This is like one of the most popular feeding systems. This is an infant paced feeding valve that creates compressions on the nipple and promotes infant-directed feedings. There's the pigeon cleft bottle. The nipple is larger, which makes it easier for the infant to latch on, and it's easier to drink from than a regular nipple. In addition, the rubber on one side, the air valve side, is thick, while the other side is thin, so that when the baby pushes lightly with their tongue and their mouth, the milk is easy to drink. Because it is soft, it is easier to help provide a smooth flow. The bottle is easier to hold and press. There's an air vent. It prevents the nipple from collapsing or the milk to flow from slowing down. There's a regulator. It prevents milk from reversing, and even without negative pressure, the milk flows just by occlusion. Some children will have to have a feeding tube placed if they do not take a feeder and if they are not gaining weight fast enough. My advice is to keep trying and try all of the feeders. A lot of moms love Dr. Brown's, but my daughter did not take to Dr. Brown's. She was a pigeon girl. So try them all. The nasoalveolar molding, which is the NAM. These, first of all, forgive me if I mispronounce something. I forgot to say that in the beginning, but forgive me if I mispronounce something. I never claimed to be an expert, and I also never claimed to be perfect. So please don't judge me. The nasoalveolar molding NAM reduces the cleft severity before surgery. I don't like to use the word severity for some reason. I'll just say that it shrinks the gap in the lip. So the device is molded by a craniofacial orthodontist or pediatric dentist. It should be worn 24/7 until lip repair, and it is comprised of lip taping, the palate obturator, and a nasal stent. The tapes are supposed to be changed daily, and the NAM device should be cleaned daily. So I noticed a lot of mothers have a hard time with the NAM. I empathize with any mom that has to use the NAM. Some moms opt out of using it or have admitted that they were inconsistent in using it. My personal opinion is that I would have used it as much as I could if we were in that scenario, because I've seen wonderful results and just the research has shown outstanding things about the NAM. And this is based on what I've learned and people that I've spoken to. And so I am all for the NAM. I know it's a tough journey, but I would recommend it. So the surgery schedule. So when the baby is between 6 weeks and 3 months, if your baby is cleft palate affected, you want to make sure that they have a auditory brainstem response hearing evaluation. And you also want to get with orthopedics for the NAM fitting. When they're 2 to 5 months, that is when you will have the repair for the cleft lip if they are lip affected and any nasal deformity. When they are between 8 and 10 months, you want to have a hearing test and an ear exam. At 10 months, you want to make sure that they have their cleft palate repaired and their ear tubes placed if needed. Between 10 and 15 months, you want to go in to have a speech and language evaluation by a speech pathologist. From the ages of 1 to 5 years old, you want to do a hearing test every 6 to 12 months. From the ages of 18 to 36 months, you're going to have their first dental evaluation. When they are 4 to 5 years old, you may want to consider a lip or nose revision. You may also consider a pharyngeal flap for VPI. And between the ages of 7 to 10 years old is the phase 1 of orthodontics. You may want to have their premaxillary expansion, removal of any retained baby teeth, and then their bone graft. Between the ages of 12 and 14 years old, you will consider a revision of the nasal tip. And then that will be phase 2 of orthodontics. That will be a full orthodontic treatment to coordinate the bite and relieve crowding and rotations. At 15 to 20 years old, you will be looking to have a final correction of the external nose and septum. And then you will go into phase 3 of orthodontics, which is just orthodontic treatment and any corrections. The alveolar bone graft is a surgery that happens between the ages of 7 to 10 years old to close the gum cleft. Bone is taken from the hip and it is used to fill the cleft. So as you can see that there are lots of surgeries and you may be concerned, these are all depending on your baby's cleft type. So you may not have to have all of these surgeries or all of these procedures, but just know that most likely the people that will be on your cleft team include your cleft surgeon, an ENT, the dentist, a speech pathologist. Those are the main specialists or people that you will be in contact with regularly in order to meet all of your child's needs. Just post-op care for babies after they have these surgeries. You may want to get a cozy coo, swaddle, or no-nos. These are restraints that are used to keep the child's or your baby's hands away from their face. You may want to have scar cream on hand, and massages are usually introduced at the 4-week mark post-op. Allow the surgical glue to fall off, no hands or toys in the mouth, syringe feed or open cup with palate repair, and make sure that you have Tylenol, ibuprofen, sometimes morphine is provided, and oxy. Those are all will help you really with the pain management. These are heavy surgeries, and so I would encourage you to just stay on top of your baby's pain in order to get them feeding, in order to get them adjusted quickly. So that's the Cleft 101. It's the basics on what you need to know if you're expecting a child with a cleft or if someone you love has a cleft. I know that this news can be hard to manage. You may be fearful, worried, stressed, but I want to reiterate that everything will be okay. Science has progressed so much, and your baby is so lucky to have you. I know this episode might trigger additional questions, and I want to be able to address them, so feel free to email us at ourforeversmiles@gmail.com, and I will address your questions in future episodes. You can also put your questions in our Facebook group. Of course, that group is linked in the episode notes here, so please feel free to join there so you can speak directly to me and also just guests that we have on the podcast. Thank you for listening to the Our Forever Smiles, Cleft Mom Diaries, and Support podcast. Be sure to subscribe and submit a review of the podcast wherever you listen to podcasts. I hope that you've enjoyed this audio experience. Maybe you cried a little, laughed a little, but more importantly, I hope that you feel a little piece of reassurance and even joy in your journey.